this is a broad culture shift that's happening not only within child welfare, but outside of us, so that government really is doing what it has to do for these families that have been left behind.
My vision is that that stigma of child welfare is gone. My vision is that we literally are taking team approaches, that we are actually coming together as a team.
The FAIR model, which is Family Assessment Intervention Response, is actually an initiative that Children and Families First connected with, I would say, over 10 or 11 years ago in response to just offering families an alternative to the traditional investigation when an allegation of abuse and neglect had been called in. So, and the differential responses is those cases where there may be more, I would say, milder level allegations, wherein FAIR or the Family Assessment Intervention Response will be able to send in a caseworker to assess for safety and, when possible, put protective factors in place so that that child is not removed from the families.
When we speak about reducing the use of the overuse of congregate care placement and congregate care placement in general, for the older youth that have come to our attention and end up placed in residential placements, we know they have been touched by so many systems before child welfare. So the work that we're doing in child welfare, pulling together our partners from Department of Health, our Office of Mental Health, to make sure that there really is a robust system of care in our communities, so that we don't get to the place of you're in crisis, mom and dad have exhausted everything in their community and are looking for help with their 15, 16-year-old, and there's a call to the state central register, and that's the pathway for service. Like, that should not happen. And so any conversation around reducing congregate care placements has to start with our sister state agencies, our co-state agencies, and how their services are provided in communities.
We originally began with those adolescents ages 11 to 17 and working with those families to put those protective factors in place when those hotline calls are called in, and offer them either case management services where it could be something simple as physical. There may have been a physical need, could have been a bed, something of that sort. If there was family conflict, then FAIR had a phase two, as we call it, where families are referred to our functional family therapy program. So we work, the program has, FAIR has case management, and then it has a therapeutic component to it as well.
We are doing a lot of work as well around, and you hear this, everyone speaking about narrowing the front door. We know a significant number of children come to our families and children come to our attention because of poverty-related matters. So we're doing a lot of work also addressing those issues much before a call is made to the SCR. We don't want to be in the space of just waiting for children and families to come to our attention. There's work for us to do with those families that are here, but a lot of work that we are doing to provide those economic and concrete supports earlier, so that we are definitely reducing the number of kids that are coming in, those that come in working through the blind removals and understanding implicit bias, and then with the kinship firewall. So this is a multi-layered strategy.
I think just a system of love and kindness, and that comes down to connection. I always go off of my 3 C's: connect, communicate, and conversation. And those are so important. If we are not connecting to one another, if we are not giving space to have conversations, we can't get anywhere.
Institutional racism, we know that has caused harms to families. Some of those harms are caused by the surveillance of child welfare. Acknowledge that acknowledge the separation and the harm that's caused by separating families. However, we also provided some solutions. And so the first solution we vowed to, number one, is to make sure that our workforce is trained in what it means to become anti-racist. We want everyone to have that foundational training so that they can implement anti-racist principles and incorporate that into their practice. That was one concrete strategy. Another concrete strategy is that we are looking at our policies. So our policies as it relates to the removal of children, to make sure that they have an anti-racist lens. And so we are doing that work with CSSP as well. The third strategy is around, we need to get into these communities, because yes, you want to roll out a support line, but you need to talk to communities, co-design with communities to find out the services that they need in their particular community.
We're building anti-racist, anti-poverty systems of care. It's with that intentionality we will truly get to the place where we are doing the very best for our families and our communities. And it's that intentionality not within child welfare alone, but across all of the sectors that touch and meet our families. And if we are committed to no longer being the system of last resort, just wipe that away from our vernacular, like that's not it. But we are going to be the voice of families that need us, and we are going to pull to this table everybody that needs to be here and center our work around those families that need our systems the most, because if we get it right for these families, it will just keep ballooning and ballooning, and we will get it right for everyone.